Prior to beginning the activity, please be sure to review the faculty information and disclosure statements, as well as the learning objectives. After listening to the activity, complete the post-test by clicking the Earn Credit link in the episode description. The following presentation is copyrighted by Medscape. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of Medscape.
Welcome to our podcast, Tech, Tips, and Tricks Enhancing Our COVID Response. I'm Dr. Hansa Bhargava, Chief Medical Officer of Medscape Education and Senior Medical Director at WebMD. I'm really excited about today's topic. It's taking an innovative approach to predicting pandemics, which we are in the middle of. What if we could predict the outbreak of a pandemic before it happened? That would have been really useful a few months ago. So let's talk about this. All of us have resting heart rates, but when we get sick, those heart rates go up. What if we could use this information to help us know when people are getting sick? This is an idea that Dr. Radin and her team used to publish a study in Lancet and have pivoted to use this information for potential predictions for COVID-19 as well. Dr. Jennifer Radin is with me here today. Thank you so much for joining us today.
Yeah, thank you for having me.
So Jennifer, before we start, do you mind just giving us 2 or 3 lines about your background?
Yeah, so I'm an infectious disease epidemiologist, and prior to working at Scripps Research, I worked at the CDC and also the Naval Health Research Center doing a lot of research around flu surveillance and respiratory disease surveillance. So I combined that background and interest with digital medicine. So I'm currently a member of the digital medicine team at Scripps Research Translational Institute. So my background combines digital medicine and infectious disease epidemiology.
Great. So I'm going to jump right into this. Tell us about your study that was published in Lancet. Were you able to detect flu-like symptoms by monitoring heart rates, and how did this work exactly?
Yeah, so the idea for this study is each individual has their own unique resting heart rate. So my typical resting heart rate is probably different from yours, and my abnormal's also probably different than yours. So we had a database of 200,000 Fitbit users from across the country who wore their device consistently for 2 years, and we identified weeks where they had an elevated resting heart rate and sleep that was above a threshold. And we found that this Fitbit variable could improve real-time predictions for influenza-like illness. And so this is really important because in the United States, influenza-like illness surveillance data is often delayed by 1 to 3 weeks. So getting this data in real time can greatly speed up public health response to outbreaks and infections.
Great. Well, that's really interesting. So what and how can we use this kind of data to help us with COVID-19?
Yeah, so as we saw with influenza-like illness, with most viral infections, we expect your resting heart rate to increase as your body responds to an infection. It's likely an inflammatory response. And we also expect individuals to be less active as they start to feel sick. They're more likely to stay in bed. Their sleep might be disrupted compared to their individual norm. So what we're doing is we're comparing each individual to themselves historically when hopefully they were not sick, so that we can identify subtle changes in their data that may indicate that they're coming down with an illness. So we recently launched a study called Detect to hopefully answer these questions.
And is it just heart rates that you're going to be monitoring, or is it sleep patterns as well? Are there other factors that could help us point to whether someone's sick or not?
Yeah, that's a good question. So through our Detect study, we are collecting wearable data. So if you have a Fitbit or an Apple Watch or pretty much any device that connects to Apple Health Kit or Google Fit, we can collect your data through this research study. And it's likely resting heart rate, sleep, and activity. All of these variables are likely impacted by an illness. We also have the ability to pull in non-sensor variables. So if someone is entering their temperature or blood pressure through Apple Health Kit, we can also pull that data in as well. So we think as we get access to more different metrics and variables, that will help us improve our models to predict infection. And as you said, resting heart rate can actually be impacted by many outside factors other than an infection. So you might get stressed, you might stop being as active, you might have maybe you had a glass of wine the previous night. And so there's many non-infectious causes that can also impact your resting heart rate. However, when we look at this data at a population level, we found for our prior study that this data was really significantly improved our ability to predict influenza-like illness. And again, influenza-like illness is a syndromic case definition for people with fever, cough, and or sore throat. So those individuals might have flu, they could have coronavirus, they could have many different respiratory infections.
That's really interesting. So you came up with this idea, and then it's really like any other study, you have to get enough patients, right? Or enough people who are willing to jump into the study. And you have a really unique way of getting people to register. It's not the old-fashioned way where, you go to a clinic and get people to sign forms. Can you tell us a little bit about that aspect of all of this?
Yeah, so our research study is all done remotely via a research app. So you can participate by downloading My Data Helps, which is the name of the app. And through this, you can go through an e-consent where you learn about the study. And you have the option to share your wearable device data and also symptoms that you may experience if you get sick. So we're collecting a wide range of viral illness symptoms, and also you have the ability to submit if you get testing for coronavirus or flu, and there's also a ability to connect to electronic health records. So this is really great because, as you know, traditional clinical trials typically involve participants going to a health center or a central place to share their data, and because of that, it takes a lot longer to conduct a research study, but doing it all remotely via a research app enables us to access a large population really quickly, and also be more inclusive of pretty much anyone in the United States over 18 who wants to participate.
And that's really an interesting point, because typically when research is done in the traditional style, it can mostly be urban centers, but previous research that you've done has shown that this method of collecting data can actually hit all the rural areas as well, right?
Yeah, we've done some other research studies. As you mentioned, PowerMom is a digital research app which collects data on pregnancy from across the country. And for that study, we've enrolled participants about 16% who are from rural zip codes, which is incredible because this population really hasn't had the same access to participating in clinical trials. And these digital platforms are really enabling that.
And from the science standpoint, it gives us an opportunity to understand the rural areas of our country as well.
Yeah, and that will be really important for coronavirus and tracking other viral outbreaks in the future after coronavirus. So we need to know which areas in the country are experiencing higher activity levels for viral illness. And in order to do that, we really need kind of coverage across the United States and participation across the United States.
So I'm going to ask you a question that our audience might be thinking of, and that is, the doctors, nurses, healthcare providers out there, as they're listening to us, they might be asking, well, how do I know that if I entered this study that my data would be safe?
Yeah, so It's entirely voluntary to participate in our study. There's e-consent, and you have the option to share as much or as little data as you want through the study. We take privacy and protection of data very seriously. All of the data is de-identified, and we're just looking at kind of aggregated results that we will publish in the end, and hopefully help us improve surveillance. And also, we're also looking at individual level changes in data to see if we can identify potentially subtle changes in an individual's data that may indicate that they're coming down with a viral illness, even before they develop symptoms.
And this type of research study does go through IRB, is that correct?
Yep, our study has been approved by our Scripps IRB.
Great. So let me ask you a question. So basically, by uploading this data from Wearables in geographic locations, you would be potentially able to identify a group of heart rate discrepancies and potentially predict the patterns of a pandemic. Am I right about that?
Yeah, so we're hoping that this data, when we look at it at a population level, that we'll be able to identify areas where individuals are experiencing, as you said, elevated resting heart rates, maybe decreased activity levels, and different changes compared to their individual norm or average that may indicate something's going on with their health. And then we will be able to confirm that something's going on with their health through these symptom surveys that are also part of the research app, and diagnostic questions about whether they got lab testing. And so we'll be able to kind of compare each individual's change in their sensor data to kind of the ground truth or the outcome that they experienced, or diagnoses that they received.
That's pretty amazing stuff. Jennifer, let me ask you a question. As you to do this area, and you and your team had done a lot of work with Power Mom and pregnancy, what have you learned in terms of being able to be agile, to kind of look towards something else immediately when something like COVID-19 hits?
Yeah, I think the great thing about having a digital research app is that it is, as you said, really agile. If we see new research questions or say symptoms that are popping up associated with coronavirus, we can really quickly change the study to capture those questions. And so we're able to modify kind of as we go and make this research study hopefully better and better. Hopefully, we also want to return really useful information back to participants. We hope it will be a platform where they can better understand what their individual normal values look like, and start to understand maybe how their data changes when they get sick.
Identifiable information is protected when people register for this study.
Yeah, so all the data that we collect is it's optional, so participants can share as much or as little data as they want. And all the data that we collect is de-identified and encrypted. And we take privacy and data security very seriously as part of DETECT. And our research study has also been submitted and approved by our Scripps' IRB.
Wonderful. And one last question. We really appreciate you being in your group. Have done collaborative efforts with different companies and different academic institutions, and have been able to really pivot quickly to help with the response to COVID-19. What are your learnings in how to do this efficiently?
Yeah, so research apps we found have been really agile. We can really modify things as we go to respond to different questions that we want to answer. For example, new symptoms that may come up, we can easily add those into our research app. The other thing about pivoting is really coming together. Our team has pivoted some of their kind of prior research work to work on this study, since it's such a big concern right now to be able to track and identify coronavirus cases across the country. So it's our team has been very agile to pivot and all come together to work on this project, and it wouldn't be possible without such a great team.
Great, I love that. So pivoting quickly and coming together to work together for a cause that obviously needs innovative solutions. Dr. Radin, thank you so much for being with us today. And, for more information, you can go to our podcast, and we do have her, Dr. Radin's study sourced. And also, please feel free to reach out to me. I'm Dr. Hansa Bhargava, both at Medscape and also on Twitter at Hansa Bhargava MD. Thank you so much, and till next time.